Our next test is related to insulin resistance, and it's something that most people can do at home with relative ease, and that would be waist to hip ratio. So it turns out that waist to hip ratio is a relatively good proxy for visceral fat. Visceral fat is fat that's stored around the organs, and it contributes to and drives the development of insulin resistance and inflammation. This metric also has been highly correlated with the risk of future chronic disease states. Now, to measure waist to hip ratio, we of course need two metrics, one being the waist circumference and then the next being the hip circumference. The waist circumference is obtained at the point between the lowest rib and the iliac crest, and I'll put up a diagram to show where that is, and that's divided by the hip circumference, the widest point around the hips. Now, most organizations typically don't have a recommendation for an ideal waist to hip ratio. Instead, what they do is they have an upper limit on waist to hip ratio that classifies as abdominal obesity. And for men, that's anything greater than 0.9, and for women, that's anything greater than 0.85. And that translates to an increased risk of metabolic disease.